welcome you all. Good afternoon to the Michigan Chronicles Roundtable on COVID-19's impact on care facilities, caregivers in the Black community. I would like all of our viewers to know that this is a phenomenal opportunity to explore a highly informative roundtable discussion today. And you'll be able to pose any question or comment that you may have on the Facebook chat. My hope is that you will gain a plethora of information that will be useful in your decision-making process regarding care for a loved one. Secondly, it is my desire that you will have additional resources to access when times may be incredibly challenging. And finally, I want you to be cognizant of some self-care techniques to utilize when you have been placed in their caregiving role. I'd like to make a special thank you to the Michigan Chronicle and Real Times Media and Mr. Hiram Jackson as the CEO. Moving right along. Perhaps you have been personally touched in your family or with a friend who has had to make decisions this past year during this pandemic, who have been surrounding you for care, concern, and love to discover what they needed to do next. So please don't hesitate to engage with us during this hour. It will prove to be very enriching. I'm delighted and excited to present this topic this afternoon with the four phenomenal professionals that are experts in their field who are present on this panel. I would like to take this time to ask each of them to share briefly about their roles and positions, as well as if they have personally been touched by COVID-19. I'll start with Ms. Crystal Hood.
Thank you, Dr. Furman. My name is Crystal Hood. I am the Director of Information and Assistance with the Detroit Area Agency on Aging. My role at the Area Agency on Aging is to facilitate the call center services and supports for referrals to programs and services that we provide, as well as to be a resource to community members who are seeking services that may not be provided by our agency. For myself, I have been blessed not to have been personally affected by COVID. I have had family members who have been ill, who have recovered swimmingly, so we have been blessed in that. There have been close friends and family members who have lost good friends that were not always ill. Some were very sudden and unexpected. So, with everything and everyone else, we just stay blessed and stay as safe as possible.
Thank you so much, Ms. Hood. Ms. Tasha Cole-James.
Thank you, Dr. Furman. My name is Tasha Cole-James. I'm one of the community liaisons with Henry Ford Home Health Care. And as a community liaison, we coordinate with our skilled nursing facilities and their community partners to assist with patient transitions and care, as well as provide support to our Henry Ford team members. As for myself, I have not personally been impacted by COVID-19, but family members in different states have, at least 7+. We have also been blessed that our family members did recover. And although I have been touched by a teacher, other extended friends and families who have had losses, sadly, from COVID-19. So this has definitely impacted, if it hasn't impacted personally, it definitely has impacted friends, families, and community all around. Thank you.
Thank you so much, Ms. Cole-James. I also want to let you know that HAP is a major provider for this presentation today, and I'd like to move to Ms. Christy Strain from HAP.
It's nice to be here. My name is Christy Strain. I am the product director for Medicare and the marketing strategy director for HAP. And my role is really with the company is to develop the Medicare Advantage product and develop benefit packages that meet the needs of the constituents and the communities that we serve. And I personally have been impacted. My brother and sister-in-law did have COVID, and they recovered really, really nicely. And my aunt passed away on Christmas Eve, living in an assisted living facility, and her death was contributed to COVID. So I definitely am happy to join this panel today to discuss the impact of COVID on our community.
Thank you so much. And Ms. Jody Luster.
Thank you, Dr. Furman. Hello, everyone. My role with Henry Ford Health System is as a medical social worker. I work primarily in the community in the home health department, where I go see patients following discharge from either a nursing facility or the hospital system. And also coordinating with our team members and liaisons that help facilitate sometimes placement into long-term care. So personally, my experience with COVID, like many of the others, thankfully, I had not contracted the virus. However, one of my closest family members did contract the virus, and they were able to recover pretty well. I've had some very close friends lose a lot of family members and friends to the virus. So the impact has been with extended family members, as well as, of course, serving and impacting our direct clients.
Thank you so much for sharing, Jody. And I'm Dr. Pauline Jones Furman. I am the Executive Director of the Center for Individual and Family Counseling, which is located in Southfield, Michigan. And I'm also an author of a book entitled When God Shows Up on the Couch. As the moderator today, I am delighted to be here and explore this conversation even more fully. I have a number of questions that I'd like to pose to our panel, and I'd like each person to feel free to jump in whenever they decide that they would like to share. Firstly, I wanted to explore the fact that we have some unconscious biases and how they play out in the African American communities in nursing home facilities. We have a number of factors that African Americans are significantly affected by, particularly in long-term care treatment. But right now, I'd like for you to think about this question, panel. What are some of the difficulties in caring for a loved one who is in a long-term care facility during COVID-19? Whoever'd like to jump out and take a shot.
One of the difficulties with caring for individuals who are in a long-term care facility include accessing that person. I know a lot of the clients who were returning from a long-term care facility because their family members wanted them home or because they were in rehabilitation and came home. The toughest obstacle for them and the family was the restrictions because of COVID's restrictions and not having family members visit. A lot of patients experience a lot of emotional trauma from not being able to see and personally be in the presence of loved ones. It was sometimes difficult for loved ones to reach them even by phone, especially if they didn't have their cell phones or if the facility didn't have ready access to in-room telephones. So there was the gap in being able to physically put your eyes on your loved ones from both sides of the coin.
For sure, and I'm so sure that had a significant impact emotionally, as you stated. Not being able to see your loved one, not being able to speak to your loved one can create some significant mental health challenges. Would anyone else like to share?
When my aunt was in her assisted living facility and was approaching getting really bad with COVID, there was that discussion about how do you have access to your loved one that is that death is imminent and there's unable to recover from this particular virus. I think it was talking to my cousins and my family members. it was like grief interrupted. It was just that inability to hold their loved one's hand and to have that final moment with them. They felt so robbed. The COVID has taken so much from us, but even in those final moments of life, not being able to share that last few moments with your loved one and share those comforting words or to say your goodbyes has left a very large void in my family's life. It was unlike maybe when my cousin's father passed away and everybody was in the room, and it was a more not joyful time, but it was a time of closure. And that not only has, COVID has taken many, many lives, but it's also robbed families of that last moment.
That is certainly correct. And that opportunity to be present, to be close, to be able to touch and speak to your loved one is so vital to our mental health. How do you think that has affected the family members, the caregivers of individuals that they could not even touch or speak to in these nursing home facilities?
Yes, it's been very difficult for family members as well as persons who are in the nursing facility. It has had a huge impact on their mental health. And as humans, we like to connect and talk and interact, and not being able to see your loved one except through maybe a window or through a smartphone has had a huge impact on the family as the caregiver as well as their loved one. So just COVID-19 in general, being distance has created a big distance between families. So it's so important, even though it's not the best, to continue to use the technology that we do have in the interim. But it's definitely had a serious effect on family members and their loved ones.
So true. Would anyone like to add?
Yes, Dr. Furman, I would like to echo what Christy and Tasha have both mentioned. The disconnect when losing loved ones. In our Black community, we are so focused on being close-knit and we hug a lot and we're always together, especially if you have a large family. For large families, this pandemic has really been stressful in that not being able to say goodbye in the proper manner or the way that we are accustomed to has brought on additional strains and depression among family members. And it's robbing, like they said, robbing us of that immediate opportunity to, present that closure that we need. As loving and feeling individuals, we all need that. And I think that this has been one of the hardest things that hit the community that I can see.
Yes, I certainly agree. I see it also in our funerals and our inability to attend and the difficulty in even going to see a loved one who has passed away. So it is all the way to the grave that we have been limited in terms of the ability to say our goodbyes. Yes. What would you say to a family member that needs to be heard? Their loved one is in a long-term care facility. They're having difficulty communicating with administrators. What would be some suggestions to family members who need to connect with their loved one, but need to go through administration?
So I would first suggest the long-term care ombudsman program. We have representative at DAAA who reaches out to the administrations in our PSA 1A area, and she stays in contact with the administration regularly. It has been difficult for even her not to be allowed to see the clients and residents of the homes because she has a personal connection to all of them. Yes. But being able to have that conduit to keep in touch with the administration helps to be able to reach out to those family members.
For sure. Any other comments?
When my aunt was in her long-term care facility and the family was limited, and there for a while she was able to go to the window, definitely keeping in contact with the administration of the facility, but they were sharing pictures. The nurses and the caregivers were so kind and gracious with their time and helping sharing moments and texts for my aunt who wasn't able to take pictures or communicate. The nurses and the caregivers became the conduit and kind of like the spokesperson for my aunt and the go-between between the family and my aunt. And we found that very comforting, that at least somebody in the facility was being receptive and caring and acknowledging the difficulties that families are having to maneuver through this new paradigm.
Thank you. As we explore nursing homes and long-term care facilities, diversity in staff is so important. When we take a look at what is happening in the African American community surrounding so many of us being diagnosed with COVID-19, participating in long-term care facilities where we are disconnected from our families, what would be some suggestions that we might offer long-term care facilities, nursing homes surrounding diversifying their staff?
That's a very difficult question, Dr. Furman. One of the issues a lot of the long-term care facilities were experiencing is a loss of staff due to the virus, where staff were either out because they were dealing with their health issues, or they were afraid because they were vulnerable because of their own health issues, or members at home were vulnerable. So there was a very interesting phenomena occurring where a lot of long-term care facilities were having a difficult time finding staff, and definitely finding and retaining quality staff, which then cuts into, how we are intentional about hiring a diverse population. There's the balance between making sure your population is represented in your workforce, but there's also the dilemma of making sure you have a stable workforce and welcoming those who are willing to work. So it's an interesting paradigm that I think we need to look at from a lot of different perspectives.
Thank you. Anyone else care to share?
I would agree. I'm sorry.
Go ahead, Crystal.
I would agree with Jody that the diversity in the nursing facilities is very important. We have such a diverse area that we cover in Southeastern Michigan. It is best that we have all walks of life, everyone be able to represent those communities that they live in. And it makes for those residents to be much more comforted when they need that extra care.
Absolutely. I just want to make sure that our audience knows that they can ask questions or comments via Facebook. So feel free to connect. It's making me think about a case that I have right now that I'll share in just a moment. But we know that in Black African Americans in nursing homes are more likely to be physically restrained more than white residents. We know that Black residents are often inappropriately using feeding tubes considerably higher than white residents. And regarding vaccines, Black residents are less likely to be vaccinated for preventable illnesses like the flu and pneumonia. So as we take a peek at the disparities and knowing that we need representation across the board, hiring good staff, keeping good staff has been a struggle during this pandemic. Many are afraid to go to work. Many have contracted the virus. Many have health challenges that prevent them from being able to do their jobs at this particular time. So as we look at the social isolation even before COVID-19, that there are a litany of consequences, including a 50% higher rate of dementia, coronary heart disease, and stroke. What are your thoughts on creating safe rooms for visits, spaces that family members, friends could visit? What are your thoughts?
I believe that the creation of those type of rooms would be beneficial to not only the residents, but the family members to be able to come in, because watching their family members through those glass doors and those windows, it was something. But again, just having that opportunity to get a closer look at them, make sure that they're okay. You know, you need to put those eyes right on your family member to ensure that it makes you comforted in knowing that their care and well-being is being focused on while they're not able to be there as often as not is normal. So I think that that would be a great opportunity for keeping individuals, you know, mentally connected. Yes.
I agree with that. I think with all the precautions that facilities are taking with the PPE, protective equipment, and sanitation, and we've learned so much about this virus, I think it would be something that every family would support, to have an opportunity just to be able to maybe lay a hand on a hand. I mean, I think during this virus, and as people are been isolated and we've had to distance ourselves, we recognize how important touch and hugging and companionship has been. So I think it will go a long way in reassuring family members that their family member in the facility is being well taken care of, and make sure that they know that they have an eye on the facility and what's going on, as opposed to everything being kind of behind glass, you know, giving them that connection would, I think, give them a lot of peace of mind.
I totally agree. I've read some suggestions surrounding having a sterile room, having large plastic that is capable of letting loved ones touch between the plastic so they are able to give a hug. The plastic is protecting them. To be able to see them close up would be a benefit to their mental health. Any other thoughts?
As a medical social worker who goes into the homes of patients who actively have COVID and haven't contracted it myself, just donning PPE properly is a very effective way of keeping, you know, both parties safe. And just piggybacking on what the other experts said about that importance of touch and being able to physically see that your loved one is being taken care of, or being able to just ask them in a private space, are you okay? Are they taking care of you? How are they treating you? And them feeling free to give you an honest answer in a safe room, that could be done. As medical practitioners, we have to don and doff all the time. And if you have a person that coordinates a safe room and is able to help family members put on the appropriate PPE and gloves and a shield and a face mask, they would be able to, you know, touch their loved one and give them appropriate hug, you know, if they're wearing their face mask and their face shield, and still have that quality interaction and be safe.
So true. Tell me what you think about what needs to be done when you think your loved one is not getting the proper care in a facility. What should happen?
Well, you
It should definitely be addressed. It should definitely be addressed by the family member directly to the administrator to advise them that they are having these concerns, so that more can be done to try and rectify the issue before it becomes a problem. Sometimes issues can be resolved much sooner than later if just addressed.
Right.
So
I agree. I agree with you, Crystal. It's definitely important to inform the administrator and all the key players of what's going on, as well as I know it can be difficult, but already having a presence, if you can, to always be checking up and following up with the important key players, administrator, director of nursing and social work, as well as the staff on the floor, the nurses, the nurse aides, just so they know that you're definitely there and involved, and not in a, in a very cooperative way, but just to know that you're present, and following up with your family member and any needs that they have.
it is so important that we pay attention, and being separated makes it more difficult. What would be some of the signs you might see of a loved one not getting the proper care or hear about?
Distance, not eating, depression, and mental stability starts changing. So they'll start being withdrawn, not wanting to, and hygiene is sometimes already a problem, but that would present itself even further. So those are some of the main things, but that withdrawal, that initial withdrawal would be the first key.
For sure, for sure. Should you take a loved one out of long-term care during COVID-19?
I think that's a difficult decision, but I think sometimes when you have to weigh the vulnerability that that individual already has, if they are a cancer patient, or if they are high risk COPD, which is, breathing disorders, prone to pneumonia, and you do suspect that the care is not what it was, when they first entered the facility, or that the facility doesn't have the appropriate staffing, or that your loved one has somehow indicated that they're not thriving in this environment. It may be a decision that is necessary for the family to have peace of mind, and for them to take more control over the trajectory of the healthcare. If you can, not everyone has the resources to bring a loved one home, having 24 hours of care with family or loved ones. But if you have that capability and you suspect that they will be more healthy at home than in the long-term care facility, it may be a very difficult decision to make, but it might be the right one for the family.
Very good. Thank you, Jody. A case that I have right now, a patient has her mother, who is 100, her father is 101. She is not pleased with the care that they are receiving in their facility. She is bringing them to her home. She will be adapting her home for them, which means that she has called in contractors to create a first floor bath, to create a bedroom on the first floor, a living space for them, which won't be finished until the end of March, because she is very, very concerned about their care, even knowing that they're at the end of life. Mother has dementia. Father is physically dependent upon a walker or a wheelchair, but this is the choice that she has made, and her brother lives out of state. So she has become the primary caregiver, will become the primary caregiver for her parents at their ages. I'd like to ask, have any of you personally dealt with being a caregiver in your life?
Yes.
I have.
Oh, no,
Sorry.
go ahead, Christy.
I have. I was married for many years, and my ex-husband got a terminal illness, and there was very limited family. We have 2 daughters together. One was a senior in high school, and one was 22. And I really was the only person that was able to, or kind of stepped up, even as his ex-wife, to fill in as his caregiver role. And even for somebody who has spent a great deal of their career in healthcare, it was very challenging for me to even going through this very emotional time and knowing that this person there was no treatment for his illness and he was going to pass away. So trying to deal with that emotion and my daughters, but trying to navigate a very complex, fragmented healthcare system and worrying about trying to get sitters and trying to work and trying to get people to come into the home and help, and people wouldn't show up, different sitter services. So it was unreliable. So I ended up taking a leave of absence from work and, dealing with the emotion of it and feeling overwhelmed and unappreciated and angry and trying to be a good mom and a good provider and trying to do it all by yourself and not being able to ask for help or turning to anybody. I think what has made me so grateful is that I'm far more compassionate and patient than I ever was, being able to help somebody die with dignity and move on and transition to death in a compassionate, dignified way, in a respectful way. But as a professional in healthcare, it has brought me to this moment where I can have an impact, that in the benefits that we look at in Medicare Advantage, can we expand benefits to include caregiver support, just even a hotline for somebody to talk to and vent, because the two people closest to me were my daughters and this was impacting their father. So just having somebody to listen to and a respite benefit and some personal care attendant that you can run out for a couple of hours and take care of yourself and not have to worry about that person while you're gone for a couple of hours. I think that that's the biggest thing that we can do in our community, is make sure that there's resources available for people in need. And I think we are hearing that message at HAP and we've responded. We had a wonderful caregiver expo back in October that was very well attended virtually. And we look forward to doing other opportunities and outreaches like that again. So I hope to bring what was a very sad moment into some good in our community.
Thank you. Any others? Caregivers? Tasha?
Yes, definitely. Just to piggyback off what Christy was saying, she used the key word of compassion, because being a caregiver does expand your compassion for yourself and definitely for others. I know for myself, I'm a part of that sandwich generation where I have a child and then an elderly parent. So you're juggling not only your job or career, you're juggling your child's schedule. You're also making sure you're on top of your loved one's schedule that you're caring for, and then your own needs. So it can get pretty hectic, but it's so important to communicate, use your resources in the community that you can, although everybody's situation is different from person to person, the amount of help and resources that they have within their family and community circle. But it's so important to, as a caregiver, definitely think of yourself as well in the picture, and maintaining your own health as best that you can. So definitely myself as a caregiver, it definitely creates quite a bit of compassion and creating a lot of patience for things that are in and out of your control. So it's definitely been a learning journey for myself.
Thank you, Tasha. When I think about being a caregiver, what would you say are some of the common challenges of being a family caregiver? What do you bump up against? Jody?
A lot of times with caregiving for family members, there's usually one person who is a little more dedicated and spends a lot more time and resources with the loved one than others. I see this so much in my other families, where there are many family members. There might be many siblings amongst the patient or their spouse's children, and it's usually that one child or that one child and their spouse who's doing like 90% of the caregiving. Sometimes their siblings or other family members live out of town, and sometimes they live close by and they're just not as involved in the caregiving process. And it's very frustrating for a lot of caregivers to have sisters or other family members who don't seem to want to support the caregiving process for a person that they feel very close to and feel like they're loved. And so I think that's a big challenge for a lot of the caregivers that I work with.
For sure. Would anyone else care to add?
Yes, I do agree with Jody. Definitely. There's always, in my experience in working with families, there's always been that, especially when we're working in a sibling situation, that one or two siblings who do, as Jody said, 90% of the work. So it does create a little bit of frustration and can create a little bit of friction within the family. So that is one of the other difficulties that can occur with being a family caregiver.
I certainly agree. I think what could be beneficial may not always work, but to have family meetings and to make sure everybody is aware of what the needs are. Everybody may not be able to give the same services that others can, but to perhaps even ask, and that's important, to ask for assistance, to not assume that you're supposed to be the responsible one, be you the eldest child, the middle child, or the baby. The idea is to seek assistance, and that might look like, can you come sit at the house for 2 hours while I take a nap? Can you allow me to run to the grocery store? I need to go to a doctor's appointment. I am just asking for this. I didn't ask for any money. I'm just asking for support. And Christy, you mentioned having the services available through Medicare and opportunities for support. I know that care.com also has staff members that provide services. So looking at what you can get versus what you can't, identifying who can help. Maybe it's a neighbor, maybe it's a friend. Might not always be family, because some people may not have your blood, but may be able to assist. So support is absolutely required. What do those caregivers need to do for themselves? What do they need to make sure that they do?
They definitely care.
I totally agree with Tasha, actually, when she said take care of yourself. I've seen so many situations where caregivers actually get sicker or maybe even die sooner than the person that they're caring for, because they've let all their needs and their doctor's appointments and they just get run down. So I would ditto what Tasha said, is just take care of yourself. And I think my learning experience is ask for help. It might not be blood, but families look completely different today than they did, years ago. So it is a neighbor, it is a friend, it is a close colleague that is there if you just ask. And certainly we're here at HAP if anybody has any questions or needs resources. We've got trained customer service agents and we've got a trained care management staff that can provide those resources in the community for you.
Thank you. Another piece that I think is important is learning how to say no. Caregivers have to also indicate what they can and what they cannot do. And making major decisions about their loved one needs to put themselves first. And Christy, the data does say that more caregivers die first before the person that they're taking care of. So absolutely putting your self-care needs first. Taking care of someone. I was the guardian and conservator for a woman that I met when she was 92 years old. And she was still living at her home, but she was becoming a fall victim. Her husband had died 25 years before. She did not have any children, and she lived alone. Her family, which consisted of nieces and nephews, were very concerned about her health and made a decision that she needed to go into assisted living. Well, she went into assisted living literally kicking and screaming. She was not interested in being there, but finally realized that she needed to be there. She did not have any mental health challenges. She started off at a facility that impacted her resources considerably and had to be relocated to another facility. The care varies from place to place, and legal participation of the family had to get in there. However, she and I were friends, and at 96 or so, we became closer, and I was recognized as her guardian. She died at 103 months. We had a few years of turmoil because it was in the court system. It was very challenging. But seeking services, assistance, asking for help are all things that caregivers need to do. What realistic expectations should caregivers have about what they can do and can't do? What should caregivers think?
Yes, Dr. Furman, that's a great, great question. I think as a caregiver, you definitely need to get out your pen and paper and first and foremost, list out people that can help you. I know that many people are very tentative about disclosing that they need help, or sometimes people see it as a weakness, but this is definitely not the time. You definitely have to definitely sort out and make a list of who can help, and then follow up with those people, just so to make sure that you have that support that you need. So before you get into any type of crisis, you have, even if it's a small support system, already in place prior to that. So caregivers also definitely to bake in schedule time for themselves with whomever can assist them with their loved one. And definitely not be shy about it. Definitely have that in place, and those boundaries as that we speak of in place.
So true. Respite care. Crystal?
Respite care is something that is so needed and limited in our community, not only with COVID, but even before then. There were limited resources available. And now with COVID, the loss of so many caregivers, direct care workers, that has even put a more strain on a needed service. It's getting back, it's coming back. We are also working on several caregiver initiatives at DAAA, along with respite care services through our caregiver support program. There's so many options that we are seeking to bring forth, and just knowing that it's just a necessity just to give those caregivers that, like they said, 2 hours, even just for a nap. They have to be able to care for themselves. But then even prior to all of that, they also have to acknowledge that they're caregivers, because many caregivers are family members who don't ever acknowledge the fact that they are an actual caregiver.
So true. Thank you, Crystal. Anyone else?
Dr. Furman, I wanted to express that one of the terms that we use is compassion fatigue, right? A lot of times people will say caregiver burnout. And just to share that, we do have, through Henry Ford, we have a caregiver support system as well. Both Tasha and I have been a part of it. We used to do, both of us, in-person groups, but of course, because of the pandemic, we've had to change some things. But that Henry Ford Health System, just like DAAA, AARP, and the VA do have caregiver support lines, and individuals who are caregiving need to know that there are virtual groups, there's virtual help, there's hotlines and tips and things out there to help them be more mindful, so that they can get resources for respite and resources for their own emotional and physical well-being.
Thank you, Jody. Anyone else care to share? How do you prepare a caregiver for end of life for their loved ones? They may be having some guilt, anxiety, some challenges, what would be some things you might suggest? Tasha?
Yes, definitely. It's definitely a subject that is easier for some than others. It can be, especially if your family member and your caregiver. It can be a very sensitive topic, but it is so important and will be such a resource and tool when that time comes. Definitely setting out time, blocks of time to discuss, and start with discussing maybe durable power of attorney, or maybe just a medical advocate, and sit down, or patient advocate, and have that time to discuss and just go page by page. Most hospitals and nursing homes do have that document. And just to get that conversation started, you don't have to finish it that day, because sometimes you have to let that seed settle in, mentally and emotionally, that this business does need to be taken care of. So
It does. I think when I was going through my situation with my ex-husband right before he passed away, you don't know what you don't know. There were so many things that needed to be done, and we were scrambling and trying to get the power of attorney a little bit too late. But a great suggestion by Tasha is that start having those conversations. We did have conversations about how we were going to manage this at home. His desire was that he wanted to die at home, and we really made every effort to make that happen, and he was able to die in his home. So just having those really difficult, uncomfortable conversations earlier than later would be so helpful for a caregiver who is taking care of somebody who is terminally ill.
So true. Christy, you touched on something that I wanted to chat about, which is, what do you do when you can't meet what that loved one wants, like dying in their home?
It was so interesting because Nathan passed away. Nathan, it was right at the point where I couldn't manage it anymore. I made that promise, right? So be careful what promises you make. And then not necessarily for that person because they're gone, but with what you have to live with, or the things that are going to impact you, or you're going to think, oh my gosh, I didn't do enough. If I had just done this or that, I could have made it happen. And I was right at the point that I couldn't do it any longer. His illness became so exacerbated that I had actually made arrangements for him to get into an assisted living facility, a medical facility, and he died 3 days before he was to move into that facility. So he was able to die at home. I'm glad he was able to do that, but I don't know, as the human being in myself, did I do enough? Could he have survived longer? Could he have had a better life if somebody was there to help me, right?
Yes.
So, those are the challenges.
So true. That's the anxiety and guilt that I was mentioning.
Dr. Furman, I would also like to add that sometimes in not just the African American population, but throughout all populations, we have this fear of hospice.
Yes.
And hospice is there to help the family prepare for end of life. What I see a lot is the resistance, because people feel in their psyche that the word hospice is synonymous with death. But if you know your loved one has a terminal illness, or that there's not much more that Western medicine can do for them, sometimes it's time to call in hospice, because the medical social workers in hospice are trained for all of these end-of-life discussions that we're having right now. They're trained to help you with that power of attorney. They're trained to help you with guardianship if that's what you need. They're trained to talk about what the loved one wants as far as resuscitation or dialysis or feeding tubes or breathing machines. And a lot of my patients, even family members, wait to call on hospice until they're 1 or 2 days from passing, and they don't get a chance to do all of that preparation that really makes that transition a lot easier for the family. So it's definitely something I think that the general public needs more education about. Hospice is good with having a sitter. Like a lot of times they have volunteers who will come and sit with your loved one so you can get respite.
Yes.
And we just don't tap into the resources of hospice. You can be on hospice up to a year. It doesn't mean you're going to die, but it does give you the support you need to plan and transition a little better.
So true. Crystal?
Like Jody said, that that myth in our community that hospice is the finality of it all, and it's just really not that. Like she said, you can be in hospice for up to a year and just be cared for and have that opportunity to prepare all of those last wishes and things and conversations, like you said, that are so hard to have anyway. I am fortunate enough to come from a family. We speak about these things pretty openly. And I know that's not true for many. So I am one of those individuals who knows, and my family knows what my wishes are. With more training and more counseling services and supports for other constituents in the community, I believe this would help to, again, eradicate that myth and help individuals to embrace some of the services and the programs that are out here that people just don't reach out to utilize because we're here. Just as HAP, DAAA, we're here to provide those resources and services. And if it's not something that we have readily available, we have partners in the community that we can certainly refer you to. And we can do that partnership by handing off those resources. We wouldn't make you have a cold call. We would definitely make sure that you feel confident and comfortable with those resources, what is most befitting to you and your families.
Thank you, Crystal. That's the piece that I think so many people don't know, that there are a number of resources that are available to assist. Some you pay, some are volunteer. The idea is to get information. I like Tasha when you said make a list, identify what you need, and then research. Oftentimes you are struggling all by yourself as a caregiver and you don't have to. Explore what can be beneficial that could help you and your loved one. They realize that times are difficult for them. In my own personal life, my mother came to visit. It was supposed to be a week's visit for Christmas. And I drove to Cleveland, picked her up on a Friday. I had a 3-year-old at the time. And by Sunday, I was disoriented. Just caring for my mother, caring for my 3-year-old, and trying to figure out how to get to church that I had gone to for 5 years, but I was lost. So the idea of the stress that is associated with caregiving is tremendous. Recognizing that we can get assistance is crucial. Knowing that could save somebody's life, the caregiver's life. Any other comments? What are some of the large and small red flags that people can look out for when it comes to selecting the right caregiver or facility for themselves or that loved one? That's coming from Ms. Noni. What are some of the large and small red flags that people can look out for when it comes to selecting the right caregiver or facility for themselves or their loved one?
I would add that the caregiver should have a connection to that person, or that person should have a connection to that individual who would be their caregiver, because they'll let you know if they're not comfortable or confident in someone immediately, most often, especially individuals who are presented with dementia. They'll buck against someone who just does not sit well with them. So just listen to them, pay attention to their body language and pay attention to what they have to say, because at the end of the day, you still have to let them be in control or give them the opportunity to tell you what they want. It's their wishes.
Thank you, Crystal. Anyone care to add? Jody?
Yeah, sometimes some families do not have individuals, family members or church members that they can call on to help with caregiving. And I know a lot of our patients have to turn to the professional caregiving arena. And so in those cases, you really want to screen the person. You want to talk to the company and you want to talk to the individuals they'll be sending to your home about what you need, about their experience, about what they're comfortable with. And it is very true. You do have to watch your family member, see how they are, see how they are around the caregiver. You want to make sure that if you do hire a professional caregiver, that they're bonded and insured, just in case something comes up missing in the household. They've got insurance that can cover it. If they're bonded, that means they're fingerprinted in with the federal government or the state of Michigan, so that there's a recourse the family can take if that person is not 100% honest. So those are some of the things that if you're hiring a professional caregiver, you want to look for, their experience. And if you can get references, that's even better. Word of mouth or references from someone that comes highly recommended is always the best bet.
Thank you, Jody. I appreciate each and every one of you and your delivery of your brilliant minds today. I want to thank every panelist, and it was awesome to listen very carefully to your experiences, your personal experiences, the things that have made a difference in your careers, and how this could be so beneficial for our audience. We gave a lot of information. We gave a lot of suggestions. We touched on the legal piece. We touched on advocacy. We touched on caregiving. We reviewed what caregivers need to do for themselves. We took a peek at nursing homes and the disparities as we explore what changes in personnel might be considered, even though we know they won't be immediate. But the idea that caregivers, family members have an opportunity to get resources that they may not have been aware of by going to the MichiganChronicle.com website. This roundtable created an opportunity for individuals to really learn a lot, to have the opportunity to ask questions and to be heard. We have personal experiences from several of you and myself as well. So I would like to thank HAP. I would like to thank the Michigan Chronicle and Real Times Media. I would like for our viewers to know that this roundtable will be available in 30 minutes online. It is the Michigan Chronicle's Facebook page that it can be found on. To each of you, thank you, thank you, thank you, thank you. Most appreciated. God bless.